Good evening students and welcome to my channel. So as you know, good history is the most important step in the diagnosis of any disease. So if we are not able to take a proper history, that means we are misleading ourselves and we may land up into some wrong diagnosis with no relief to the patient. Similarly, for any surgeon to be a good surgeon, he must know the various stages and various aspects of healing of a wound. The main work of the surgeon is to cut the tissue, to remove the tissue and to suture the tissue. But ultimate thing that happens is the healing of that wound that is created by the surgeon. So if that wound does not heal or heals very slowly, that means there is failure of the surgical procedure. So as a student, as a surgeon, you must know how the wound heals so that you know beforehand in the pre-operative stage, in the post-operative stage, that these are the factors that can lead on to delayed wound healing. And if these factors are correctable, so you can correct those factors, those deficiencies which are essential for healing of a wound. That is one thing. So if the surgeon has performed his surgical procedure in a very meticulous way, but ultimately if the healing does not take place, that means total failure of the procedure. So healing is the most important step in the surgical procedure and the result depends upon the health of the patient, nutrition of the patient, oxygen supply of the patient. So this is the one thing. So as we know that for any building, any repair work for any building, you require manpower as well as the raw materials. So any of these, whether the manpower is missing or manpower is low, any of the raw material is missing or low in quantity, if the manufacturing unit is sending the content but on the way the roads are not good, there will be hampering in the process of construction or the repair. So similar is the mechanism that is prevailing in the human body. So wherever there is any injury, any infection, so in case of injury, there is, you can say, the auto healing process of the body that starts. So in that area, the inflammatory process starts as soon as the injury occurs. So what exactly is the inflammation? So inflammation is basically the body's healing response to any injury or any infection. So wherever there is injury, so spontaneously the healing process starts immediately. So that's why the first stage of the healing is known as the inflammatory stage, that is stage 1, and the stage 2 in which there is formation of the granulation tissue. This is known as the granulation phase or the granulation stage. And the stage 3 is known as the scar formation, in which the scar once formed is continuously being remodeled according to the tension over the surface of the scar. So stage 1 is the inflammatory stage. It starts from the day 0 and it remains till the 4th day of the injury. So from 5th day onward till the 20th day, the granulation stage starts. And from 20th day onwards, the scar tissue keeps on modifying or remodeled by the tension lines along the scar tissue. This is the one aspect. So today we will discuss the inflammatory phase, that is the stage 1. So as soon as the injury occurs at any site, so there is creation of the wound. So what exactly is the wound? Wound is basically the breach in the continuity of the skin surface or the epithelium. So whenever this wound occurs on the surface of the epithelium or the skin, so there are many changes that starts immediately. First is the chemotaxis, second is the phagocytosis, third is the, you can say, the formation of the matrix, fourth is the, you can say, that is the hemostatic plug formation, and fifth is your angiogenesis. So these are the things that takes place. So there is slight first is the wound, second is the chemotaxis, third is the formation of the plug, fourth is the formation of the matrix, and then is the formation of the blood vessels, that is known as angiogenesis, and the epithelialization of the scar tissue. So this kind of things takes place. So what happens when there is injury? So some biochemical substances are released into the circulation, and through circulation they cause the aggregation, or the, you can say, the collection of various types of cells which are responsible for destruction of the debris and the dead tissue, and the phagocytosis, and the deposition of the various other matrix, and the formation of the plug. So what are these cells? For phagocytosis is important because the dead tissue that is present at the site of the injury, the bacteria or virus that are present at the site of infection, so these are phagocytosed and destroyed by the lysosomal enzymes. The main cells which are responsible for these are mainly the neutrophils in the initial stage, and by the end of the 4th day and the onset of the 5th day, mast cells predominate. So the function of both mast cell and the neutrophils is the phagocytosis, and ultimately the digestion of the bacteria and the dead tissue. Then the second thing is, when these cells accumulate, second cells are the platelets. Whenever there is any injury, there is accumulation of large quantity of the platelets at the site of the injury. Within 3 hours there is formation of the hemostatic plug at the site of the injury. So this plug stops the bleeding, and it also stimulates the kinin and the complement system. So clotting system starts there, that forms the hemostatic plug, and the other things start simultaneously. So that is the deposition of the fibrin plug. So second, then there is other things that happens, and these are like your capillaries vasodilatation, capillaries engorgement, and the increase in the permeability of the capillaries. So the most important thing here is the increase in the capillary permeabilities, and this permeability causes the escape of your WBCs and your platelets from the lumen of the capillaries into the extravascular space for the deposition of the matrix and the phagocytosis of the debris and the dead tissue. So this is the one thing that happens, and all these 3 things happens, you can say, this is by the stimulation by the histamine and your prostaglandins and the serotonin. So these 3 chemicals plays a role in the dilatation, engorgement, and the increased permeability. So these chemicals are produced by some mast cell and various other cells. So now by the end of the 5th day, there is formation of the raw matrix along with the accumulation of the mast cells and the neutrophils and the fibroblast and the mesenchymal cells, which can change into any form of cells. Either it is your endothelial cells, your fibroblast responsible for the deposition of the collagen fibers and the neutrophils, which are responsible for the phagocytosis, and the mast cell, these are also responsible for the phagocytosis. So as we know, to produce or to construct a new building, we first have to have a clear space for the construction of that building. So now at the site of the injury, these cells are depositing the scar tissue or healing, producing the healing process, and in that healing process there will be deposition of the scar tissue. For new scar tissue to be laid down, the dead tissue has to be removed, which is removed by the mast cells and the neutrophils. So by the end of your 4th day, 5th day onset, so mast cells keep on appearing and the other cells keep on disappearing, and the cells which are responsible for angiogenesis, cells which are responsible for the deposition of the collagen fiber, that is the fibroblast, these are increasing day by day, and by the end of 5th day the mast cells are the predominant cells and other cells have already done their functions and they starts disappearing slowly and slowly. So thank you very much, and do subscribe my channel and wait for the next stage of the healing, that is the granulation phase. So that starts from the 5th day and remain till the 20th day of the injury. Thank you very much.